22-year-old woman presents to her primary care physician's office with recurrent episodes of swelling in her face, hands, and neck. She also complains of occasional abdominal pain. This symptom usually resolves in 2-3 days. She has had these episodes of swelling her entire life. However, they have become more debilitating recently. Last week, she had an episode that restricted her ability to eat and swallow. Past medical history is non-contributory. Her father is alive and well with no significant medical history. Her mother and maternal aunt have a similar condition to hers. So remember, congenital over here. Today, her congenital being hereditary. Today, her physical examination is unremarkable. She brought a picture of her swollen hand as shown in the attached image. Laboratory evaluation shows C1 inhibitor levels are extremely low. Which of the following is the most likely diagnosis? Okay, so our lab evaluation has given C1-INH is very low. This is a dead giveaway. This is the image. So our options are option A, Digeorge syndrome, option B, Chediak-Higashi syndrome, option C, Wiskott-Aldrich syndrome, option D, paroxysmal nocturnal hemoglobinuria, option E, hereditary angioedema. Let's go with it. This particular question, what you need to know is that anytime hereditary angioedema, which is the answer, it always has low level of C1 inhibitor. Now what C1 inhibitor does is it prevents the formation of kallikrein. Okay, the cycle of kallikrein, heavy molecular weight kallikrein breakdown, and it prevents other. Let me show it. I think they would have cycle. Yeah, here it prevents the breakdown of kallikrein. Okay, and it also prevents the degradation products of C1 and C2. So plasminogen, this is not material, but here kininogen and bradykinin, they both cause angioedema, bradykinin particularly. So C1 inhibitor is more important to prevent kallikrein from breaking down kininogen into bradykinin. That is most important. So just remember that anytime any person presenting with similar complaints of face, head, or neck having such uh, you know complains that there are swelling and it is recurrent, and there is here we also have that maternal aunt and mother have similar condition, so it is a hereditary. We have a hereditary pattern seen over here. So when we see that, it is pretty obvious that it is hereditary angioedema. Now for all the rest of the options, Chediak-Higashi, Digeorge, the child should be small. Wiskott-Aldrich also, where the child is usually, it's a child. For Chediak-Higashi syndrome also, usually it's a child. Paroxysmal nocturnal hemoglobinuria. Now this can be seen in an adult, but it is quite rare to see something like this, and it will of course not have a presentation like this.
Thanks for watching. Please give a thumbs up and subscribe for more.